The stomach normally acts as a reservoir, slowly releasing food into the small intestine, allowing for proper digestion and nutrient absorption. In dumping syndrome, this controlled release is disrupted, causing a sudden shift in blood volume, which can lead to symptoms like dizziness and rapid heartbeat. Dumping syndrome, also known as rapid gastric emptying, can occur after surgeries like weight loss or cancer removal. These surgeries alter the stomach structure, affecting how it processes food. Essentially, food moves too quickly from the stomach into the small intestine, bypassing the normal digestive process. This rapid transit bypasses usual digestive processes, leading to uncomfortable symptoms such as nausea, abdominal cramps, and diarrhea. Imagine a traffic jam suddenly released. That's similar to what happens with food and dumping syndrome. The sudden influx can overwhelm the small intestine. While distressing, it's often manageable with dietary changes and lifestyle adjustments. Eating smaller, more frequent meals can help. The stomach normally acts as a reservoir, slowly releasing food into the small intestine, allowing for proper digestion and nutrient absorption. In dumping syndrome, this controlled release is disrupted, causing a sudden shift in blood volume, which can lead to symptoms like dizziness and rapid heartbeat. With proper management, most people can significantly reduce the impact of dumping syndrome on their quality of life. Consulting with healthcare professionals is key to developing an effective management plan. Dumping syndrome symptoms are divided into early and late categories, each with distinct characteristics and onset times. Early dumping syndrome typically occurs 15 to 30 minutes after a meal, often catching individuals off guard. Common early symptoms include nausea, which can be quite unsettling, vomiting, abdominal cramps, diarrhea, bloating, dizziness, and a rapid heartbeat, making it difficult to go about daily activities. Late dumping syndrome, on the other hand, occurs 1 to 3 hours after eating, often when you least expect it. These symptoms are related to the rapid release of insulin in response to a sudden influx of sugar into the bloodstream. Symptoms of late dumping syndrome include weakness, sweating, trembling, confusion, and intense hunger, which can be quite distressing. In severe cases, hypoglycemia can lead to loss of consciousness, requiring immediate medical attention. Recognizing these symptoms is crucial for effective management and timely intervention, ensuring better quality of life. Differentiating between early and late dumping syndrome is essential for effective management and patient care. Early dumping syndrome occurs shortly after eating, typically within 30 minutes. It is related to the rapid emptying of stomach contents into the small intestine. This sudden influx overwhelms the small intestine, causing symptoms such as nausea, vomiting, diarrhea, and abdominal cramping. Additionally, the shift in blood volume can lead to dizziness, a rapid heartbeat, and even fainting in severe cases. Late dumping syndrome, on the other hand, is related to the body's insulin response to rapid sugar absorption. This condition triggers the pancreas to release a large amount of insulin, causing blood sugar levels to drop significantly. Symptoms like weakness, sweating, trembling, and confusion typically occur 1 to 3 hours after eating a meal. Understanding these mechanisms and their timing is crucial for effective management and improving patient outcomes. Dietary modifications are key to managing dumping syndrome. Eat smaller, more frequent meals to prevent rapid emptying, limit simple sugars, and focus on complex carbohydrates. Choose whole grains, fruits, and vegetables over refined grains and sugary foods. Include lean protein sources and healthy fats in your meals. Lying down after eating can help slow gastric emptying. Avoid drinking fluids with meals. Drink between meals instead. These dietary changes can significantly improve your quality of life. By making strategic changes, you can reduce the frequency and severity of your symptoms. While dietary changes often suffice, some may need medical intervention. If symptoms are severe or unresponsive, consult your doctor. Medications like acarbose and octreotide can help manage symptoms. In rare cases, surgery may be necessary to correct anatomical issues. Regular follow-up with your doctor is crucial, especially after stomach surgery. If you experience new or worsening symptoms, contact your doctor promptly. They can assess your symptoms and determine if further intervention is needed. Don't hesitate to reach out to your healthcare team for support and guidance. Living with dumping syndrome can be challenging, but manageable. Combine dietary modifications, lifestyle adjustments, and medical support. Keep a food diary to track symptoms and identify trigger foods. Support groups can provide emotional support and practical tips. Reach out to your healthcare team, family, and friends for support. Focus on nutritious, whole foods and adopt mindful eating practices. Managing dumping syndrome is an ongoing process. Be patient and experiment. With the right approach, you can live a full and active life with dumping syndrome.